This video is presented by TRACS WA, Training Centre in Subacute Care. In this scenario, 83-year-old Mr. Peacock has undergone a total laryngectomy for thyroid cancer. Today he's visiting senior speech pathologist Peter Graciette about his leaking voice prosthesis.
Hi Mr. Peacock, what brings you in today? I wasn't expecting to see you.
No, the valve's been leaking.
Ah, okay. How long's that valve that you've got in been in for?
About 3 weeks.
About 3 weeks since you changed it. Has this ever happened before?
Oh, once.
Once. And do you know what was causing the leakage?
I've no idea.
What did you do to stop it?
I used a brush to clean the valve.
So you gave it a clean?
Yeah.
Okay, and that got rid of the leakage?
It stopped.
Yeah, so we can probably assume that the valve might have been blocked. And is everything sort of as normal with your voice?
Yeah.
Yeah, nothing different with your swallowing?
No.
Okay. A leaking valve can be a problem because it's allowing fluids and sometimes saliva to travel from your esophagus or your food pipe into your trachea or your windpipe. That can be problematic because it can introduce infection when we get what we call aspiration, which is the term that we use for when fluids are moving into your airway. It can also cause coughing and discomfort when the fluids are leaking through, and some people even find that embarrassing when they're going out to eat or drink. All right, well, I'll have a bit of a look at your stoma and your valve. So everything looks great there. It's all really clean and clear of secretions and everything. Your valve looks really good. I'm just checking to see that the valve is there in the first place and it doesn't look out of place or anything, and everything's good there. First thing I'm going to get you to do is to have a drink. Now, I've got some brightly coloured water here. It's been coloured blue with food dye, and that just means it's really easy to see if it's leaking through the valve. Okay, so I'll get you to have a bit of a drink while I'm watching for leakage. Great. Okay. And I can see some blue coming through now. That's leaked. First thing I'm going to try is cleaning your valve, because often the valve can leak if there's a bit of dried phlegm or mucus stuck inside the valve, or even a little bit of food stuck on the back door of the valve that's just trapping the valve door in an open position to allow the leakage to come through. All right. So I'm just going to get in here and give it a clean. We'll see if that's done the trick. Have another drink for me. Okay. Unfortunately, I can see that it's still leaking, so that hasn't done the trick. What we'll get you to do next, I'm going to try you with some slightly thicker than normal drinks, and the idea is they're thicker and they move more slowly and they don't run as easily into the valve to leak through. So this is what we call a level 150 thickened fluid. You can see it's just slightly thicker than normal. It's about the consistency of like a nectar, and it just moves a bit more slowly. So have a drink of that and we'll see. And I'm just watching the middle of the valve for any leakage. And I'll get you to have another couple of sips of that just to be really certain it's not leaking so far, which is good. Great, that's not leaking so far, and I'll get you to have one more. I'd like to see you have more than 1 or 2 sips to make sure that it's not leaking. And just go one more to be sure. Okay, so I'll grab that from you. When you're having the slightly thicker than normal drinks, your valve isn't leaking. Okay, so that's how we're going to manage this for today. That you continue on, instead of having normal drinks, you're going to have to thicken them slightly, okay, just for the short term. Have you ever had thickened fluids before? Nope, so I'll need to show you how to mix those up and what to do there. What you've got here is a box with the sachets of thickening powder, okay. You've got 24 of those in here. And the instructions for how to mix it up are also written on here. So it's pretty simple and straightforward. You're going to put the thickening powder into your glass first. 1 scoop equals 1 sachet of powder in the box. Pour the liquid over the powder in the glass, stir it for 20 to 30 seconds just with a teaspoon, and then you're ready to drink it. Okay? You can make up larger quantities if you want. You're going to adjust the amount of powder that you're using. So if you prefer to make up a large quantity just at the beginning of the day, so you only have to do it once, you'll just adjust how much powder you're putting in. Okay, so it's 10 scoops per litre. All right. Does that all make sense? You think you'll be okay with that? Yeah, and you can thicken any drinks. Tea, coffee is okay to be thickened, hot drinks, cold drinks, juices, cordials, those sorts of things will all be thickened, okay. All right, so I'll pop this all in here for you. So because we've seen that your voice prosthesis is leaking today with normal drinks, we need to get you to be particularly vigilant with checking your, for leakage over the next little while until you can see your speech pathologist, just to make sure it doesn't get worse, even though the thickened fluids weren't leaking through today. We just need to make sure that that continues to be the case. Usually you'll cough when your voice prosthesis leaks because it irritates your airway, but not always, all right? So I just want to go through how to be checking that in the mirror. You don't need to be checking it every time you have a drink, but when you're doing your voice prosthesis care and cleaning, I'll get you just to have a drink and check that there's no liquids coming through the middle of your valve with your thickened fluids, all right? So I'm just going to get you to turn towards the mirror, and we're just going to go through how to check for leakage. I'll give you my torch to use and get yourself into a position where you can see your voice prosthesis and your stoma quite well. And I'm just going to point out to you where we're going to see the leakage coming from. That's it. So have a look in the mirror, and we're just checking the centre of the valve to make sure there's nothing coming through when you swallow. So if you just do that once or twice a day, just incorporate that into your daily care until we get you to see your speech pathologist, that'd be great.
What do I do if it leaks before I see the speech therapist?
If it does start to leak again, what you'll need to do is come back to the hospital, okay? Don't have anything to eat or drink because it means that the problem's gotten worse, and you'll need to come back. We'll need to do more assessment, so it might be the case that you need to have your drinks even thicker to stop the leakage, but it probably also means that you need to go and see your speech pathologist possibly for a valve change sooner rather than later. So when I'm thinking about short-term management of a leaking voice prosthesis, really what I'm trying to do is just stop the risk of aspiration, because obviously that's putting the patient at risk of developing a chest infection and discomfort and embarrassment. So what we're aiming to do is to put a solution into place that's doable for the patient and that's solving the problem, i.e. the aspiration, until they can get to see their speech pathologist to form a longer-term solution to the problem. We generally see 2 types of leakage. The first one is leakage through the voice prosthesis, and that can occur for a number of reasons. The first one is that the valve has become blocked with secretions or food particles, which stop the valve door from closing basically, and that allows the liquids to move from the esophagus through to the trachea and causes the aspiration. Another cause can be candida, so candida deposits can form on or around the valve door, which again stop it from closing completely. A third cause can be just general wear and tear, where the valve has reached the end of its lifespan and it no longer functions as it should. We also can see leakage around the valve, which is not as common, but we do see it. Causes of that need more urgent attention from a speech pathologist or an ENT surgeon. That can indicate complications with the tracheoesophageal puncture itself. It could also mean that the valve is ill-fitting. It could be too short or too long, or the valve could be partially dislodged. In any event, any of those scenarios need to be looked at very quickly by a speech pathologist because they can lead to further complications.
TRACS WA would like to thank the staff and management of Sir Charles Gardner Hospital for their involvement in this project. This project received funding from the Australian Government.